Good afternoon and welcome to the City Club of Cleveland. My name is Paul Harris and I'm president of the City Club's Board of Directors. Healthcare has been a frequent topic at the City Club during the past few years. Earlier this year, international journalist T.R. Reid shared his research and insights on how developed nations provide healthcare to their people, pointing to some rather striking comparisons between the United States and the rest of the developed world. Last October, we looked at the future of diabetes care with Lars Sørensen, Chief Executive Officer of global healthcare company Novo Nordisk. In August 2013, Stephen Lieber, President and Chief Executive Officer of Healthcare Information and Management Systems Society, discussed the importance of the electronic medical record. And a few years ago, we held a program series called Place Matters. In that series, we focus on the impact of place and community design on public health care outcomes. One of the series speakers, Ron Sims, former Deputy Secretary for the United States Department of Housing and Urban Development, discussed the correlation between neighborhood obesity rates and the proximity of accessible playgrounds. Now, an aside on the subject of obesity, just this morning in the Wall Street Journal, there's a report that states that approximately 30% of the world is overweight, with over 50% of obese people living in 10 countries, including the United States. Sometimes Clevelanders, proud of their city's outstanding healthcare institutions, jokingly refer to Cleveland as a great place to get sick. Of course, it would be more appropriate to say that Cleveland is a great city in which to get and learn how to stay well. Clevelanders are also very proud of the city's outstanding arts and culture institutions. So we are really pleased to offer a panel today that will discuss the intersection of healthcare and the arts, with a panel moderated by a well-known arts and culture executive who is joined by three policymakers. Earlier this spring, the Community Partnership for Arts and Culture, or CPAC for short, released a report called Creative Minds in Medicine. The report explored what the arts have to offer: healthcare environments, healthcare delivery, healthcare training, and the broader mission of improving healthcare outcomes. The argument made in the report is that arts aren't something extra, a nice thing to add if there's room in the budget. Rather, the report suggests that any healthcare conversation that doesn't include the arts isn't really examining or exploring the whole picture. Our moderator and panelists will examine the report and its policy implications. Today's conversation will be guided by Tom Schorgl, President and Chief Executive Officer of CPAC. He is joined by elected officials Joe Cimperman, Dave Greenspan, and Nickie Antonio. Mr. Cimperman serves on Cleveland City Council as the representative of Ward 3, which spans downtown and the near west side. Mr. Cimperman is a Democrat and chairs City Council's Health and Human Services Committee. He has served on City Council very distinguished fashion since 1997. Mr. Greenspan serves on Cuyahoga County Council as a representative of District 1, which includes the communities of Bay Village, Westlake, Fairview Park, North Olmsted, and Rocky River. Mr. Greenspan is a Republican and serves as chair of the Council's Operations and Intergovernmental Relations Committee. And last but not least, making her first appearance at the City Club, Ms. Antonio serves in the Ohio House of Representatives as representative of the 13th District, which includes Lakewood and the west side of Cleveland. Ms. Antonio, Democrat, is the ranking minority member of the Health and Aging Committee and the Joint Medicaid Oversight Committee, among many other committee assignments. So with that, I will now turn the program over to our moderator, Tom Schorgl.
Thank you, Paul. It's a pleasure to be here with you today, and just a bit about the Community Partnership for Arts and Culture. We're a service organization. We don't produce any art. We don't present any art. We try to strengthen it and connect it and unify it within this community. And clearly one of the things that we're about is defining the arts in its full worth. And defining it in terms of Creative Minds in Medicine is our most recent effort at that. Just four things in terms of if you don't have a copy or haven't read a copy. By the way, they're free. You can either get a hard copy or PDF by going to our website, cultureforward.org. It breaks into four particular categories. Arts integration in the healthcare environment. In other words, the infusion of arts and culture when it comes to the design of settings and where healthcare and medical treatment are given to individuals. Participatory arts and health, the engagement of individuals and communities in arts and cultural activities, and therapies, very important, therapies for the promotion of a broader clinical and general wellness outcomes. Arts health integration with community development, public health, and human services. The ability of arts and culture to strengthen social ties, serve as a rallying point for communities to address public health and social equity issues. And finally, arts and culture in the medical curriculum. The enrichment of medical training programs through the incorporation of arts and culture. I just want to take a moment to thank CPAC's Board of Directors, many of them are with us today. CPAC staff works very hard, and in particular, Kristen Putch, who's the Director of Research and Advancement at CPAC, and Nicholas Matthew, who's our Research Fellow, and of course, the Volunteer Advisory Board that worked on this particular publication. These people, these organizations help us open the doors. The Cleveland Foundation, the George Gunn Foundation, the John P. Murphy and Coulis Foundation, Kresge Foundation, the Educational Foundation of America, Cuyahoga Arts and Culture, and Ohio Arts Council. And a special appreciation to the generous project support that we received from the Surdna Foundation. And now on to our panelists. My first question and prompt is, in terms of arts, health, and human services, can you share with us any sort of example that you've had personally when it comes to this intersection? Floor is open.
Why don't we start with the rookie?
Oh, no pressure. Well, as far as my own experience, it's interesting. We were talking about our children before we sat up here, and my oldest daughter is an artist and a musician, and also a massotherapist. So right there, close to home, we have that connectivity of what we're talking about today. And Ariel did a project a few years ago called Resurrected Light, and it took found objects and a lot of glass bottles and put it together and created sort of a gazebo, but it was also ended up being this very healing place. The energy within that space was amazing. And even today, it's in Phoenix, there are people who go and sit and meditate there because the atmosphere, and she was very intentional when she put it together, but the atmosphere it created was something that people were drawn to, both for the art, but also because it put them in touch with them thinking about their own healing. And so I think things like that can really encourage, embrace, and also celebrate the intersection of all those things, make it very, very powerful.
So when I was younger in our community, we had in the St. Clair neighborhood a community center, and they did different things for kids to keep them out of trouble because we were teenagers and we were always in trouble. Yes, and I think those records are erased. But one of the things we had, and I have never shared this before, was we had a lip syncing camp. And I was one of the silver medalists because I did Stray Cat Strut in the summer of 1984, I think. And that was an interesting thing because we had a teacher who I believe was a part-time volunteer through the YMCA. The teacher had a beatbox, and we basically were told to perform. When I was a little bit older, where arts and healthcare for me intersected a little bit, and I was thinking about it on the way over here, was my mom, when I was growing up, she had really bad bipolar disorder. And one of the things that always pulled her and the other people out that she was staying with in the hospitals that she was in was they had really intensive and successful occupational therapy and art therapy things. So inevitably, when she'd come home, we'd have all this new art in the house that you could tell was kind of a degree of her getting better. But one day, I was young, and we had to visit her over the Christmas Eve, Christmas Day, and we were bummed because she was going to be in there. And we knew that she was really sad because she hadn't had a chance yet to buy us any gifts because she had been hospitalized. So we get off the elevator, the 6th floor of the psych ward at St. Vincent, and she had 3 chalkboards with the phonetic version of Silent Night, Holy Night in Slovenian, and she convinced everybody who was up there to carol to us. as her gift to us. And I'll say this to you, and I have kids now, so I know that the gifts they give me are really important, but I don't think there's a better gift I've gotten with arts and therapy in my life.
Great. Dave?
Well, great. Well, thank you. You know, life is about experience, exposure, and relationships, and those who have heard me speak, I talk about that. And drawing my relationships here closer to Northeast Ohio, you know, we've been very fortunate, my wife and I. My wife served for a few years as the chair of the Beck Center, and I see Cindy Einhaus and Ed Gallagher here from the Beck Center. And the Beck Center itself does some phenomenal work as it relates to art and music therapy. There are other organizations in Northeast Ohio that I don't personally have anyone in my family that is a consumer of services from the Department of Developmental Disabilities or the Achievement Centers, but I do a lot of work advocating on their behalf because the work they do is really tremendous. And as I spent time at both those facilities and at the Beck Center, and we see the work that is being done to help consumers, depending on the division that you're working in, their consumers, their students, towards working through the issues that they are dealing with and some of the challenges through the arts is really astonishing, and it's very heartwarming to see that. We live here, I've only lived here now, July will be 7 years in Northeast Ohio. We have some phenomenal assets, and we talk about the arts and culture as being a significant component of our overall culture in Northeast Ohio, and we've got a phenomenal business community. We have phenomenal performing arts, our sports teams, our restaurant scene, and this is a major significant component in the arts and culture as it relates to not only the overall fiber of Northeast Ohio, but helping those in our community come through some tough times, and whether it's some of the examples we've heard here or others that we will never hear of, that this discipline really helps them through some very challenging times. So I'm flattered to be part of this today to talk about it, but I think our community and what we see and what we don't see is very important to help strengthen our region as a whole.
Thank you. Next prompt. As we know, there are a number of pressing health issues. And I'd like to ask you to talk a little bit about those disparities that we face in terms of health and in the community. And how would you see from your experience and your jurisdiction in terms of government, arts and culture playing a role? Does arts and culture play a role when it comes to addressing health issues and the disparity in terms of maybe service in terms of health issues? And how, if it does, and you don't have an example on the tip of your tongue, what would you think might be the role of arts and culture in that particular area? So I'll open it up to the panel, and don't all raise your hands at the same time.
Well, let me just say, I know Raymond Bobkins here from Cleveland Public Theater, and if people want to see an interesting example, and forgive me, Tom, but I think a little bit of the book is a misnomer. It is Creative Minds in Medicine, but it's also Creative Minds in Health. And I say that because in two specific examples with regard to what Cleveland Public Theater does and the support that it receives from the community, with the CPT youth program, the STEP program, those kids are coming from all over the city of Cleveland. They're coming from public housing. A lot of them are coming from families where this may be the first time that anyone in their family has been in a theatrical performance. But these kids write, direct, under the direction of Raymond and Chris Siebert. They do this fantastic job. And then they perform in a park, and people from Tremont to Detroit Shorewood University Circle stay and watch them. Now, go in the fall when the same organization, Cleveland Public Theater, does the Y Haven program, which is a lot of men who are in alcohol and chemical addiction recovery. Probably a lot of them have seen the inside of a jail cell. They get standing ovations, right? So I don't know, I'm not a pharmacist or a doctor. I'm not measuring their blood pressure. I have to think that fundamentally for those young people and for those men who are in recovery, after the performances and the experience that they're part of, their lives are better and their disparities are less, right? They've made connections. They've created a fan club. They have friends. And if you ask me, the number one cause for homelessness in Cuyahoga County has as much to do with medical issues as it does with people who are disconnected from the people that they love and who love them.
And it's interesting that you brought up the Y Haven program, because I was thinking about that, and there's actually a women's component as well. There's been work done with the women, and for many of them, it's an opportunity to give voice to some of the things that they went through, as well as the men that participate. and maybe for the very first time, also sort of take back their own agency and power to own it, and to be able to contribute to their healing. So I think that it's, like you said, as far as measuring somebody's blood pressure or whatever, we can't ever know the true impact, but we do, I think, see it then as they go on about their lives, whether it's participating in treatment. And this is an amazing audience. So Bill Denahan is here from our local Adams board, knowing about how recovery works. People do recover. And I also see Stephanie Morrison Herbeck in the back from Near West Theater. And again, it's that group of people that come from the neighborhoods from all over to participate. And one of the amazing things they do is they take the participants, the people who are going to be on stage, through this amazing discussion about the issues involved in every play that they work on. So when our daughter was involved in Carousel, they talked about violence against women and what appropriate relationships look like. How amazing is that? For some people who have never set foot on a stage before, to have that kind of a powerful experience that then incorporates that they can walk away with some lessons learned and really put them into their own lives, to work in their own lives as well.
Well, and I'm going to pivot a little bit off of what Councilman Cimperman said when we talk about arts and reaching a constituency that sometimes might not have access or has never had access to constituencies. And this is kind of an interesting spin, and people don't really look at it this way, but if, you know, our Juvenile Justice Center houses 100 to 130, sometimes more than that, children. And I say children, they're typically 9 to 18. We recently have had some a little older. And they have done some outreach programs with various performing arts organizations to come in there. And they talk about people who have oftentimes never been exposed to any arts and culture whatsoever, are starting to participate in programming. They witness it, they see a program, whether it's music or some type of theater or the like, and then they leave there with a different feeling of self-worth. And whether you take the pulse or a prescription towards that, it's hard to really define. But isn't that what we're all talking about, is reaching a constituency that has never experienced a form of art or performing art, period. And now we've got a group that hopefully when they leave their time at that facility or wherever they're going, will have a separate and a different appreciation, that they'll be able to take that with them and maybe become a performer themselves. But at least they're leaving there with a different sense of appreciation than they did when they were prior to them being exposed.
And you know, I think that's one of the strengths of doing these kinds of programs. When I was working in a women's center, which was an outpatient treatment program, and we were dealing with the issues around HIV and AIDS, we looked at models of how the prevention message was conveyed to groups of people. And in developing countries, it's all done through theater, through coming to a village, coming to a community, and performing, and getting some of the people from the community involved, indigenous to that area, to be involved in the performance, which then strengthens the message and really gets a community to own it. And then they're successful. And I always said, why don't we do more of that here? And I think it's something that as we have this discussion, there are areas where we need strong prevention messages for all kinds of issues we're dealing with that I think would be very well received and very effective if we use those kinds of methods.
Well, let's build on that in terms of what you do as lawmakers, and that's make laws. Where do you see the arts and cultural sector when it comes to its priority within health and human services? How they could come together to work together from your perspective to begin to take both of those assets and exponentially make them more valuable to the community. So I'll just put it on the table. How do you think the arts and cultural sector and the health and human services sector works together from the point of view of public policy?
Well, one of the things that I was able to participate in, a few of our legislators, was a program that Tom, you and CPAC and some others hosted, where we got to go around in Greater Cleveland and look at some of the programs where there is an intersection going on. That is a first step, by educating legislators and city council folks and county council folks, first of all, to get that threshold of understanding of where the programming is right now, what's happening that we're not even aware of, and then through that, building to conversations. It was so interesting the day we did that tour. I actually had a couple of conversations with Ed Gallagher from Beck Center and a few other folks around the need for licensure for music therapists. And so I went back, talked to one of my colleagues across the aisle, Mike Davila, and we just introduced legislation to be able to license music therapists, to have a formal licensure process. And of course, because of that discussion, now we've heard from art therapy folks, and we've heard from dance therapy folks, and from other folks, and it's great. Because what we're talking about is elevating the level of professionalism and recognition of their training and what they bring to treatment right now. So that's an example of how it is possible, but it starts with opening your mind to the understanding of what's available right now.
Would you say that the music therapy and the art therapy and the dance therapy folks are pretty strong advocates when it comes to advocating?
I would say so. There's probably many of them in the room right now, and we won't be able to get out of the room without talking to them, I'm sure, which is a wonderful thing. I mean, yes, and the strength in their advocacy. Again, on a day-to-day level, when we're dealing with all kinds of issues of a legislative nature, unless somebody brings it to your attention, you're not aware that there even is a way to make things better, to improve the system.
You know, funny thing is, we're talking a lot about therapy and medicine, and it kind of implies in the conversation, you know, ideas and philosophies around something like a cure. Mm-hmm. I've always said this about Cleveland, and this is such a Cleveland conversation right now between healthcare and the arts and you know, really thoughtful public policy. The issue in Cleveland isn't whether or not, you know, we found the cure for polio, or we're, you know, discovering how to eradicate infant mortality and other issues. It's an issue of access. Mm-hmm. And so as a person who's involved in legislation, sometimes it's not as much about passing laws as it is but opening the door for organizations like Young Audiences, Music School Settlement, and letting them do what they do, which is beautiful, to and for and with people who normally don't have the ability to afford a ticket or to get there. So, you know, for me, you know, thinking about, you know, again, the work that happened a couple weeks ago in Ohio City with Station Hope, which was the oldest church in Cuyahoga County, which is an Underground Railroad site. It took a group of 150 actors to invite 3,000 people for people to kind of get connected. And, you know, I go to a lot of events, and a lot of times they're pretty homogenous, but I've never seen as diverse a group as African American, public housing, you know, white people from Tremont, you know, people from the suburbs. And it's just, there's very few intersections like that in our lives, let alone in Cleveland, and the arts has that opportunity. And, you know, for those moments, what it does in terms of helping people understand our history, but also the fact that Cleveland was a place that helped to liberate people who were in bondage, it has a pretty amazing effect. And the only thing you have to do is open the door. Just open the door. And that's what I think CPAC and so many of the arts organizations in this room are attempting to do, and that's what we should do more of every day.
And I just want to throw in that that was an awesome event. And part of it, too, is that it's not always about pathology and therapeutic, but it enriches our lives. And we get this wonderful opportunity to celebrate, which probably does then actually do something for all of our blood pressure. If I can get outside of all the issues I'm dealing with for a day and just, I never smiled I can't remember smiling as much as I did the day we were at Station Hope. Part of it was because everybody was seeing people they knew, but the other part was just how beautiful it was to be in a place where there was so much energy and positive action going on and so much diversity. And we were all so excited to be there with each other. And I think that's what happens when we put all of it together.
Well, and I would look at it from our perspective and from the county council's perspective. Our discussions primarily, and this is going to dovetail on we're talking about communication, getting the message out there. Our body focuses primarily with arts and culture in an economic development perspective. There really hasn't been a whole lot of discussion on the health and human service side. And I looked at Bill Dennehy, there's no greater advocate for what Bill does than Bill, and Bill's a phenomenal advocate for the Adams Board. But these are items that we need, so I'm looking at Bill to help us out here. We need to start becoming more engaged. Now remember, we're only 3.5 years old, so we're still new and trying to understand exactly the new government and how we fit into things. But all of us in this room understand the value of arts and culture and medicine, but it's not widely known throughout the greater community. And you may see it touched on in economic development. I'm a firm believer that this is a component of our overall economic development strength. And you may see it touched in a couple other disciplines, but the focus on health and human services really has not been widely known as being very popular or something that the community should start to embrace. It's been very limited, very restrictive. And so from a communications, a PR perspective, it's something we all need to carry forward. And I know a lot of us in this room, beat the drum every day, but we really need to gain some strength and gain some momentum to really talk about the intersection here and how important it is in our community.
I have one last prompt before we go to the break, and that is to the arts advocates, the cultural advocates, the arts and health and human services advocates out there. What is it as an elected official that turns you on when a constituent comes forward and presents something, and what turns you off?
Now, we talking arts and cultural just in general?
Well,
because we can really expand this topic very quickly.
We're talking sort of in general, but you're talking to an arts and health audience. So as we go forward, public policy is important, and this group of 150 to 175 people are all advocates, and they want to know what you would like to hear in terms of a lawmaker and what immediately turns you off. Joe?
So what I really love when organizations come forward and are either seeking some change in legislation for people's ability to play music outside, or for festivals, or for performances, is when people are leading with an idea of being about I'll just say it, a very Matthew 25:35 perspective. There is something about art that is very equal and comparable to any fight for civil, racial, social justice. And it's why we listen, it's why we do it. It motivates us, it makes us happy. But when there are communities in my ward that are not getting by easily in this life, when an organization like a school settlement or a theater group or an arts organization or an orchestra says, we really want to know how to reach out to this group of people, that makes me think that they're really understanding the role for arts, at least in the city of Cleveland as we have it right now.
You've got 30 seconds, and you've got 5 seconds. No. Okay.
Well, when someone comes and they are enthusiastic, bring us as much information as possible. They don't have to know the total way to go forward, especially in the political realm. That's my job. But be the expert and bring some flexibility to their plan. I will tell you what is very much a turnoff is when it needs to be done either tomorrow or yesterday, and there's an expectation that we can make miracles happen overnight. So we need the timing to be right.
Okay.
So I really have...
No, you're...
So I would say one of the things that excites me is when a constituent or an organization comes forward with passion and a plan, but more importantly that plan is all-inclusive. It's very difficult to deal in our world when we talk about segmenting out a very specific segment of the population or a very specific concept that doesn't have broad appeal or doesn't reach as many people as we would like to be able to reach. The thing that frustrates me, Tom and I were talking about this earlier, is when we get incomplete thoughts or concepts, and we often get that. Somebody says they've got a great idea, but there's no background or no detail behind it, which leaves us in a very precarious situation to try to interpret what the message is. And as the representative said, we don't have to know everything, and we don't expect the constituent to know everything, but help us through the process of what you would like us and how you would like us to help you. But I would say that the number one thing that motivates me is passion. Whether I agree with the decision or not, or the perspective, the passion is really what drives and motivates me to continue to do what I do.
Thank you. Paul, I think it's over to you.
Well, today at the City Club of Cleveland, we are enjoying a Friday Forum panel discussion on creative minds in healthcare with Cleveland City Councilman Joe Cimperman, State Representative Nickie Antonio, and Cuyahoga County Councilman Dave Greenspan, and moderated by Tom Schorgl, President and Chief Executive Officer of the Community Partnership for Arts and Culture. We'll return to our panelists in a moment for the traditional City Club question and answer period, and would ask that you start formulating your questions now and try to keep them as brief and to the point as possible so we can get a lot of questions in. We welcome all of you here and those joining us through our primary media partner, 90.3 WCPN, 104.9 WCLV, and WVIZ PBS Idea Stream, or on one of the many other radio stations across the country that carry City Club programs. Television broadcasts of the City Club are made possible by Cleveland State University and PNC, and our live webcast is supported by the University of Akron. 1 week from today, on June 6th, the City Club welcomes Dr. Barbara O'Brien, Policy Director for the National Campaign for Grade Level Reading. For more information about our upcoming and past forums, please visit our website, and that's www.cityclub.org. Today, we welcome guests at tables hosted by the Cleveland Clinic, the Community Partnership for Arts and Culture, and Metro Health, and we thank you all for your support and attendance today. Today's forum is in partnership with the Community Partnership for Arts and Culture and University Hospital's Seidman Cancer Center, and we thank you for your support in making today's program possible. Now, as promised, we'd like to return to our panelists for our traditional City Club question and answer period. We welcome questions from everyone here today, including guests, and holding the microphones today are City Club Associate Director of Advancement, Mike Grimaldi, and City Club intern here from Case Western Reserve University, Spencer Kiesel. First question, please.
Panel, in your remarks, you mentioned that the people who had performed in public were doing so for the first time and had had no prior exposure to the opportunity to perform in the arts, music, or anything else. The state has done a good job in the last couple of years cutting support for schools. And one of the areas in which schools have reacted has been the absolute gutting of arts and music education. So I'd like to include Mr. Schorgl in the response to the question, what, in your view, should the arts organizations and each of your levels of government be doing to reinstitute music and arts so that our young people can grow up actually getting a broad-based education?
Why is everybody turning towards me? Well, thank you for that question, because, and this was not a setup, because earlier this morning we had the Arts and Cultural Roundtable, and we had Pat Cirillo, who's a researcher, and Bob Morrison, who's a researcher in terms of arts education. I think it's very important when it comes to changing policy, in this case getting more funding back into arts education, music education, dance, is that with policy comes accountability. And accountability can be divided into two areas, the quantitative and the qualitative. And clearly, when you look at Cuyahoga County, and we just finished doing an opinion survey back in December, when we looked at the question, this was of 404 voters, what is one of the most important things that arts and culture provides to this county? Arts education was at the top of the list, significantly at the top of the list. If you look at Cuyahoga Arts and Cultures, who is our public sector funder. They've just released their annual report, and they show what the return on the investment is when it comes to the arts education programs. And I think when lawmakers start to see not only the qualitative, not only the intrinsic, which is important, but for some lawmakers, you need to see the instrumental value. And we have data that can back that up. What we also have is a very sophisticated arts and culture and health and human services advocacy group. And when we can join those advocacy groups, arts and culture, health and human services, neighborhood development, community development, and education, sir, I think we can get that changed.
So, one of the things about funding anything is, especially in our state, is that it has to be a priority. So we start from a place of if education, public education for all children was a priority, we would see higher spending levels for education. I'll start there. Too often we talk about the arts, and then everything else. Being separate from each other and siloed off, much like Western medicine has sort of leaned towards there's your head, there's your body parts, but somehow we're not considered this integrated machine that we actually are. I believe that we should tackle our educational system and priorities the same way. And so the arts are just as important, and sometimes the vehicle by which some children learn math, if the math problem is presented to them in a rap, they will never forget that. So it's about really prioritizing, I believe. And we are lacking. The coalitions help us to push, but it also takes an engaged society, an engaged citizenry to be paying attention and to hold all lawmakers accountable for those educational priorities.
I think, Mr. Lustig, I think your question was excellent. And, I know from being a parent of a daughter in the Cleveland Metropolitan School District, we asked the questions when she started school, what were her art teachers going to be, what was her music teacher. I will say that the school district in Cleveland that I work with a lot has done a lot to hold the line. But I will also say to you, we all get the government that we deserve. And if people think that elected officials like Councilmember Greenspan, State Rep Antonio, and I don't listen to people when you come talk to us, I hear all the time, oh, I wish we would have done more, and I said, you should have done more. We encourage people to do that. I'll share this with you. When I was in high school, we had a group of people that were doing these wonderful dramatic performances, and a group of us got together with our teachers and said we wanted to do something a little bit more unique. And I was part of a group that actually did the play One Flew Over the Cuckoo's Nest at Metro Health Hospital Psych Ward. And I will tell you right now, you want to talk about education, you want to talk about healthcare, some of the patients were actually starting to interact with us on stage. And I have to tell you that for all of us who are in that play, we will never forget that. That's the moment in education when it crystallizes. By the way, I was Cheswick.
To go look that up.
I'm an engineer, so I want to ask an engineer's question. The Cleveland Clinic is using magnetoencephalography, where they put sensors around a person's head to measure the electromagnetic waves that people put out when they think. This technology is showing promise for addressing chronic alcoholism, schizophrenia, Alzheimer's, and other diseases. The National Institute of Standards and Technology has now developed a new sensor that is going to make this technology 100 times better. And would the Greater Cleveland please consider bringing in this new technology to Cleveland, developing it, implementing it, and then exporting it around the planet?
Yes.
That was a good answer.
I'll back you up.
We will.
Other questions?
This program today is devoted to the arts and healthcare. My question is not about the arts, but about health care. The big issue today, it seems to me, involves the Affordable Care Act, the so-called Obamacare. And we have three people here today who are representing different legislative bodies. Joe Cimperman of the Cleveland City Council, Nickie Antonio of the state legislature, and David Greenspan of the county legislative body. And my question is, to what extent does each of you think, maybe personally rather than on behalf of your organization, do you think that the Obama health care program could be improved if instead of having multiple insurance companies, we had something similar to Medicare, in which there's a single payer? I'd be interested in your comments.
Well, I'll jump in first. If I were queen of the world, we would have single-payer health care. I'll just say that. Because Medicare, or Medicare for all, because the program has been proven to work. As it is, that is not what we have. But we do have the Affordable Care Act, and there have been many, many people, thousands of people that have been able to enter into the system because of the changes. And we've seen it, whether they have pre-existing conditions or they've not been able to afford it. Our own Metro Health did the wonderful pilot project to really show that when bringing folks in that had never been in the healthcare system before could be accomplished, and it was very successful. So I'm hopeful as we go forward. But what I also want to say is when we looked at one of the things about incorporating the arts into the healthcare system, you know, I went to Cleveland Clinic and University Hospital, and when you see someone changing the temperature and the setting of just walking in the front door because there's a violinist playing as you walk into the lobby, or people who are engaged with dealing with life and death issues of a family member can sit and hear a pianist play, and can sit in a place where there's a waterfall and there's beautiful art on the wall, and the art helps them find their way around the hospital, which I love because I get lost all the time. But when that's possible, it means that people who are very new and engaging into some of these huge systems are welcomed in the front door, and they are made to feel comfortable and that this is a place where they belong. I think that will really make an incredible difference in the future of not only getting people to walk in the front door, but then engage positively with the health system.
I would, and the representative, we have a good relationship. We respect one another. I don't necessarily share her opinion on this. I'm kind of a free market guy and believe in competition will drive not only quality service but also competitive pricing. But that doesn't mean I don't believe that there needed to be healthcare reform. And I believe if you look in Washington, and if you were to sit down with members of Congress, and I've talked to a few of them, there's a large band of agreement in items within the Affordable Care Act, whether it's pre-existing condition or children staying on until they're 26. Where there's a discourse is obviously in the last 10%, which is where you see a lot of discourse in legislation. And people don't realize in Columbus how closely Republicans and Democrats work together on most issues, but the big divisive issues is where the media jumps right on top of it. We at the county level don't have that issue. We're bipartisanly elected, but we all work collectively together, and Cleveland is all of one party. But what I would say to the extent of the Affordable Care Act, we're still trying to understand really what's in it and how it's truly impacting society, not only from a healthcare perspective, but also from a cost perspective, because some of the taxes and the fees associated with it have yet to even be implemented. And some were implemented very early on, and people had no idea. I'll give you an example. I had a friend of mine who was in the suntan bed industry. He had no idea that the first tax implemented under the Affordable Care Act was a tax on suntan beds and suntan care. And a lot of us in this room might not be aware of that. So we're still learning. I think it's early and to really understand the full impact. I would say healthcare reform is clearly needed, but to the extent to which the ultimate outcome will be determined is still, in my mind, still in question.
Bill Denahan, representing the Adam Board. I wanted to comment about the importance of today's forum in that in an environment where we're struggling to make access for care and treatment, that the voters of Cuyahoga County voted and improved the levy last year. And to Councilman Greenspan, I want to assure you the money that you approved last year, for the first time ever, the Adams Board is having an art therapy program. So thank you very much.
And if I can, real quick, to that point, and people don't necessarily understand really what county government's all about. So I had some of our staff put together just an analysis, and I'll just share with you broad strokes. Through the funding, and Mr. Denahan was correct, the levy that the residents of the county approved, and it's very important to understand that residents of the county have a very strong passion for supporting this. Obviously, we've seen it pass every time. The money that was approved merely backfilled the revenue shortfall that was realized by the property valuation issue. So that the money that was voted on, the $1 million increase, merely provided us to provide the same level of service. But to that end, in the arts and therapy community, the county doesn't do anything directly. We provide funding to organizations that do, such as the Adams Board, the Department of Developmental Disabilities. I saw Director Petty, she's no longer here, but they have their own levy. But through various other organizations, we provide funding for close to 20 various organizations through, I say we, the county directs it through the levy that was adopted by the residents of this county to support these programs. So our council and our county government is very supportive of this community and what we're doing, and we try to ensure that when we appropriate money, and Mr. Denahan and I have had some very good heated discussions about ensuring that the money, that the taxpayers' money is being spent appropriately and wisely. I'm confident, I'm more confident today than I was 3.5 years ago when we took over, that your dollars are being spent effectively and efficiently, and we continue to monitor that to make sure that every dollar that comes in, because those dollars are very precious, and we realize that the outcomes that we expect, and we hold all these folks accountable to not only ensure that the dollars are being spent appropriately, but that the services that are being delivered are the appropriate services for those who are in need in our community.
Hi, Tom and panel. Thank you very much. One of the biggest public health ventures going on now that just started is with the Northeast Ohio Regional Sewer District. And as we know, there is at least a debate that has been brewing about how those funds are going to be used for kind of the mega industrial approach versus a smaller community-based approach. And I'm just wondering if this is an opportunity for the arts community to get involved as well in creatively reshaping public space in concert with those in the environmental community. And just like to hear your thoughts about that.
I can answer that. We do a program with Cuyahoga Arts and Culture. CPAC runs and manages the Creative Workforce Fellowship program. And one of the requirements if you receive a fellowship, which is basically research and development as an individual artist, performing visual literary artist, you have to have a public value, public engagement component. We've seen a number of different artists take their skills and their abilities to address public issues. One group of artists, one artist addressed human trafficking and the terrible problems that are associated with that. Most recently, we had a fellowship recipient who developed, designed and developed a water reclamation process that's built out of material that you can find anywhere at very low cost and is a piece of sculpture. So in terms of individual artists, they're creative people. They can come up with great ideas, especially when you take individual artists, regardless of discipline, and partner them with engineers and with people who understand clean water problems. And here in Cleveland, in Cuyahoga County, we have those assets. We have those folks. We have great engineers. We have great people who are environmentalists, and we have great individual artists. So more of that, I think, will continue to happen as artists are a part of this community, and they want to see everything that we want to see as taxpayers. Good value on your return. And I think those are a couple examples of it.
Hi, good afternoon. I'm Neil Hodges with the Neighborhood Connections, and my question is, in yesterday's Plain Dealer, there was a story that said Cleveland was ranked best nationally, number one for healthcare access. When you look at Cleveland Clinic and UH, which is in University Circle, and then if you look at the communities that surround UH, some may argue that that community doesn't have access to these two anchor institutions in that University Circle. So my question is, what role should the arts institutions, the Museum of Natural History, the Museum of Art, CIA and others, what role should they play in addressing that issue? And you may have answered that in your case study, I haven't read it yet, but what role should the arts institutions play in breaking down those barriers that some feel that those neighborhoods, Glenville, Wade Park, Huff, Fairfax, Central, East Cleveland, have? Because I believe some will argue that the residents don't have access to those two institutions. Thank you.
Well, as someone, I can share with you who's been a witness to some of the great work through the leadership of the Cleveland Clinic, University Hospitals, Metro Hospital Cleveland, as well as Sisters of Charity St. Vincent. There was an effort on the part of those institutions themselves, let alone the phenomenal institutions that you mentioned around them, to engage in something a couple years ago called Healthy Cleveland. And what that effort really was trying to get to, its heart, was how to create more bridges for people in those communities. And as a son of St. Clair Superior, I can share with you that I grew up with and was in a family with a lot of people where healthcare issue was access was an issue. It's challenging. It's challenging trying to deal with divides in culture. Trust issues are huge. And as somebody who works for the city of Cleveland and is the chair of the Public Health Committee, I have a lot of really good intentions, but I find myself knocking on a door a lot longer than getting in. And I mean that there are so many barriers, I think, that we put up ourselves. One of the reasons why I really love the arts and I love the organizations who are in this room is that there's very few places where people kind of put their shoulders back and allow themselves to just be. Maybe it's Wade Oval Wednesdays, right? Maybe it's on Martin Luther King Jr.'s holiday when everything's open for free and you see people going to those places that don't go every single day. Maybe it's Arts in August in Tremont, where you've got the health center or the hunger center letting out at the same time that the restaurants are opening, and you got this weird intersection of picnic blankets of homeless people and people that are dining at one of Michael Simon's restaurants. I don't know. I guess I don't have the answer, but I'll say something because you make me think of this. The arts organizations in this community have such a moral authority that is not used as often as it could be. And when I see the institutions, the clinic, UH, Metro, and St. Vincent stepping up, and they are stepping up to figure out how do we do more, because none of us think we're doing enough, I can't imagine what that looks like, but you're making me think that that's something that I want to put my head to because I think that's an amazing idea.
And can I just say before we that I also think that when we do the reverse, it's great to open the doors on those days. Absolutely wonderful. It's great to hope that sometimes some of our children. My first exposure to the Cleveland Orchestra was going on a school trip because I was a West Side of Cleveland kid, and my family wasn't going to even figure out how to get to the orchestra. That was foreign to them. So my first exposure was through school. But I also think it's critical that the institutions go to the neighborhoods and in that, making that connection. And we're starting to see that, I think, more and more all the time. But it's that cross-pollination that happens that really will get especially our children and our young people to understand that it's an integrated life that we're trying to do across the board. But I think it's imperative that the institutions come to the neighborhoods.
I feel like the bearer of bad news because we have to stop, unfortunately. But today at the City Club, we have been listening to a forum on creative minds in healthcare with Cleveland Councilman Joe Cimperman, State Representative Nickie Antonio, Cuyahoga County Councilman David Greenspan, and Tom Schorgl as moderator. Thank you very much to all of our panelists. Thank you, ladies and gentlemen. This forum is now adjourned.